you speak light in the darkness. My God, that is who you are. You are here, touching every heart. I worship you.
I worship you. Ladies and gentlemen, good afternoon. You are listening to Source of Information, the only place where you could get the best information regarding Medicare, Medicaid, low income subsidies, and the benefits that's about to come in 2026. Not all the benefits, because we cannot discuss benefits today. However, I have a young lady, she's very good at what she does. She looks gorgeous on the screen. And we're talking about none other than Miss Suzella Dazom. She's going to go by, we're going to discuss basically in 2026, prescription drugs going to take a change. And she's well equipped to really explain to you guys what does that mean in your pocket in terms of co-payment, who's going to pay for what, and she's going to break it down in layman terms how you guys could understand it. Suzella, welcome to Source of Information. Welcome back. It's been a long time. Where have you been?
I've been here, and thank you for having me today.
Now, we haven't seen you yet, so oh, there she is. Okay. Wow, you look gorgeous.
Oh, thank you.
Now, let's talk about some of the things that's happening in 2026 regarding prescription drugs.
As far as the extra help and so forth.
Right.
Okay. Well, there will be a change because it used to be where a lot of people who are especially on Medicare and Medicaid didn't have a copay for any of their medication, regardless on the tier level. They were paying zero copay. So that is going to change next year.
Okay. How so? How is it changing?
It's changing where they're gonna have a copay depending on the level of their the level of their medication.
Okay.
All right, even with extra help. So first and foremost, there's a system that's called low income subsidy.
Right.
Right. Okay. So if the person qualify for low income subsidy, they'll pay the reduced amount on their medications.
Mm-hmm.
So, but when someone who have Medicare, Medicaid, they automatically qualify for low income subsidy, but their Medicaid, because they have a Medicare, Medicaid plan, they weren't paying anything for their medication.
Okay.
So that came about since COVID, and they weren't paying anything for their medication. But starting next year, they are gonna pay a copay depending on the level of the drug that they're taking. The tier that their drugs falls under.
Okay. So if it's a tier 1, for example.
Tier 1 typically are generics, tier 1 or 2. So there won't be a copay pertaining to tier 1 and 2. However, it's going to be when it comes to the ones that are taking brand name medication, they're going to have a copay.
Okay. And like a medication like Ozempic, they'll definitely have a high copay, right?
If Ozempic is considered a brand name medication, yes, they will have a copay. Mm-hmm.
So I know what's the maximum they on a brand name that they would spend, because I know
$2,100. It's $2,000 this year. It's $2,100 next year.
Okay, not a great difference, but the $100 nowadays, the time that we live in now, could make an impact on their lives.
Mm-hmm. Absolutely.
Because I know before they used to have it from $0 to $2, then it went up to $3, then I think it's up to $6 now.
What for generics is gonna be up to, I believe, $5.10.
Okay.
And $12.65 for brand name medications.
Now, for those people, first of all, how do you become eligible for low income subsidy?
Okay, perfect question. So, what? Let me give you a little information about the low income subsidy, like a little breakdown of it,
Okay.
right? So, how it works. So, of course, it's always been around low income subsidy. So now they kind of send in mail to all the Medicare recipients this year.
Mm-hmm.
To all the majority of Medicare recipients are receiving letters from either Social Security or their insurance company to apply for low income subsidy if they didn't have it already. Okay. So, what to expect in 2026, including key changes and rules, right? The low income subsidy is a federal subsidy that helps Medicare beneficiaries with limited income and assets pay for their Part D prescription drug cost, premium, deductibles, and coinsurance.
Okay.
It's administered by the Social Security Administration in coordination with CMS, which is Medicare, right? Some people qualify automatically, and those are who, if they have Medicaid, they automatically qualify for it, or those who own SSI and certain Medicare savings programs. So these people that will automatically qualify for the low income subsidy. So if you do not have Medicaid and your income falls into a threshold where you qualify for extra help, you would want to apply for that because it's gonna help pay your costs on your medications. It's really crucial that you apply for it. Okay. Now, now, if you want to know about the limit, the assets and limits to see if you qualify, or am I going too fast?
No, no, keep going. You're doing
Okay.
fantastic.
Okay. For 2025, for example, the resource limit are $17,220 for individual. So that means if your income is less than $17,220, you will qualify for the extra help.
That's
And if
good.
you're a couple, it's $34,360. Okay, so that is for 2025. And
And do you have the amount for 2026? What is it going to be?
I don't have that amount yet, but it's just going to be a little bit higher, not too much higher than what it is.
Yeah, because whenever they give an increase, that affect the low income subsidy is threshold as well, right?
Correct. That is correct.
So potentially the increase might be somewhere between 2.7 and 2.8. So you could basically add something like that, 2.8 to whatever the calculation is. That would make the difference on the increase for everyone for eligibility for 2026. That's great information to have. And you said for it's 17,000 17,000 plus for an individual and 33,000 for a couple.
34,000 for a couple.
34,000 for a couple. So
Mhm.
basically, a large amount of people that are listening to us right now will be eligible for or is already eligible for low income subsidy.
Yeah. And that will actually help them a lot because, it all depends on, the medication. Some people take high cost medications. So imagine if your medication is a tier level 4, where you have to pay 35% of that medication, instead of you paying 35% of the cost, which could be $200-300, you're only going to pay $12.65 for that same medication.
Hold on, repeat that one again. You sure that's correct?
Yes, if you qualify for extra help.
So if you qualify for extra help, if you had a co-payment of $200, the extra help going to kicks in, and the highest you're going to be paying is $12 and
And
some.
65 cents, depending on the level of extra help, because there are different levels.
Okay, tell me about the
Hmm.
different levels.
I don't have that
Okay,
information as yet.
well, that's a homework for you to do for next Wednesday. How about that?
Absolutely.
Okay.
That works.
No, I know, I could appreciate you don't have them because those information are just coming out as we speak
Hmm.
for 2026. So the true numbers for 2026 haven't come out. And next week, and this is the next segue because we have plenty of time to talk about this next week on the 17th. The amount for cost of living adjustments coming out. So we'll get into that a little bit later. So that's good to know because the individual who do not have low income subsidies right now, so they have time to apply for it. Now, how do you help them uh, apply for a low income subsidy?
Through they could either we could help them apply for it for sure. So they would call and we help them apply for it,
Okay.
or through Social Security as well.
Okay. Yeah, you go on. You have access to the website, and the website you could apply for it as well.
Yes, and majority of them have already received the Social Security is right in everyone. If not, I don't. A lot of the Medicare recipients are receiving mails about the low income subsidy extra help, and then some of the mail come with the actual application for them to fill out.
So if you have, if any of you that's listening right now, you have that application, and especially if you're in Broward County, you could always contact Suzella um, at what's the phone number?
754-236-4994.
Okay, and she's located at should I give the address for you, the information for you?
Sure.
She's located at Alto Health in 4850 West Oakland Park Boulevard in Suite 125 in Lauderdale Lakes, Florida. You bring the application there. We'll sit down and fill out the application for you and then hand it over to you. I think it's a self-paid postage. It's a prepaid postage. You just basically put the application in the mail and then send it and wait for them to approve you. If you fall under that criteria, because that's one of the things they're going to ask in that application, how much money you make in a year, if you have any extra money in the bank, and so on and so forth. So I think it's worth it to call Suzella, or if you need Suzella's phone number, you could call me. Give them the phone number again, Suzella, before we get
754-236-4994.
754-236-4994. I'll repeat it again. 754-236-4994. Let's talk about the other thing is what's about to happen in 2026 regarding the premium for the Part B.
That's a question for me.
Yes, it is.
Yes. As if no everyone hasn't been aware of it, that premium is going up next year.
How much is it going up to?
$206.50, I believe.
Yeah. Now, what can we do to help everyone that's listening right now from paying that $206.50?
There's different helps, right? Different types of help to pay the Part B premium. So if you're not already aware of that amount that we mentioned when you have Medicare Part A and Part B is attached with the monthly premium. Typically, they take that if you're receiving Social Security, they take it out of your Social Security, or you also, if you're not yet receiving Social Security, you have to pay it directly to Medicare. Okay, every 3 months or however you like to pay it. Now, some people qualify for Medicaid. If you qualify for Medicaid is assistance from the state that you could apply for, where you get help paying for your Part B premium. and you apply for that. You apply for Medicaid through Department of Children and Family, or I myself, Gilbert, we help those who want to apply for that. And it's based on your income, right? So those who qualify for the Medicaid, that type of Medicaid is called Medicare Savings Program. So if you qualify for that, it will help pay the Part B premium. The full Part B premium will be paid. So you'll get your full amount on your Social Security check each month. There are other options, but you'd have to call me in reference to that.
Yeah, there's plenty of option. Basically, yes. Once we sit down with Suzella will go over different options that you have.
Right,
Um,
because it's not everyone. Sorry to cut you
that's
off. So
okay.
every for those who doesn't qualify for Medicaid, they don't know that they also could have something that will help them pay for it through their Medicare plan as well.
Very well put. Very well put.
Mhm.
Again, yes, we could help you apply for a Medicare saving program that's going to help pay for not only the premium for Part B, but also we're going to get into a program that we've been talking about for over a year now since we discovered how we could accomplish that and help you, which is how to help you get Medicare Part A and Part B, although you did not work for 40 quarters. We're going to get a little bit about that in a minute. But, Suze, do you have any last word regarding the low income subsidy before we move on?
It's very crucial. A lot of people don't. If you haven't received a letter from Social Security, um, give us a call. Because with the extra help, it'll help you pay your not only your prescription drug costs. If for those who just have a prescription plan only, without with and using original Medicare to for their medical needs, the prescription plan is attached with the premium, and that extra help also help pay for your premium. So it's always better to have a Medicare Advantage plan all combined, but some people choose to have just a prescription plan, and then the Medicare alone. So that extra help will help pay for that prescription drug coverage. So it's very crucial that you guys fill out that application to see if you qualify for the extra help.
That's a good point you brought up because those days of having just a Medicare plan and a Medicaid plan, Medicare and Medicaid plan, those days are over. So anybody that's listening, if you just have a Medicare and a Medicaid, you don't have a Medicare Advantage plan accompanying with that, you living in a stone age. Because what's going to happen is simply this. Because when you have the Medicare and you put the low income subsidy with it, you put the Medicaid with it, and now you have a Medicare Advantage plan, that's how you're able to get coverage at 100%. So at the very least, you have a minimum of on tier 4 or 5 drugs. You got what, $12? A minimum of $12 copayment. So don't make that mistake. Make sure you contact someone who knows, a professional who knows about the different plan, the advantage of you being in a Medicare Advantage plan. One of the things that Suzella does very well is sit down with you and compare the plans and go over the drug that you are currently taking, and see which plan is going to cover it best for you. So don't make that mistake and walk around with just a Medicare card in your hand, and then you're not getting coverage. You're not getting the full use of the plan. Anything you want to add, Suze?
We approaching the enrollment period. It starts next year. This is the time to do all your reviews. It's always good to review your plans because plan changes year to year. So it's best that you do that during this time of year, especially 2026. A lot of changes that's going to happen within the plans. So you want to do a plan review with your current plan. Okay.
Great, great, great. Thank you for that. Thank you for that. Now we're gonna attack a different subject. As you know, a lot of our people in the community that have come to the United States and don't have significant coverage in terms of you have to be 5 years residents in the United States for you to apply for Medicaid. And if you don't have, if you're not a citizen and you don't have, you're not eligible for SSI, then you can't get Medicare. But now we discover a different way where you could get Medicare. I want you to talk a little bit about that for me.
Yes. Typically, to get Medicare, you have to work enough quarters, which equals to 40 quarters to be eligible. So it's not everyone that's in the United States that have, that have worked. So if you're, like Gilbert said, if you're in United States, you have 5 years of being here, you could technically apply for Medicaid, right? And once you apply for Medicaid, you would come to the clinic and then we apply for a different type of Medicaid for you. And then we submit that to Social Security. And Social Security will provide you a Medicare number. It's a process, but it works. Social Security will provide you with a Medicare number. And then from there, you'll be able to get your Medicare activated, Part A and Part B activate.
Good point. Good point. There's a question I wanted to ask you. It kind of escaped me from that, but I'll come back to it. Um, so you have to go. You first of all, you have to come to the office for us to help you with that.
Absolutely.
So we have to file for Medicaid for you.
Right. Some people already have Medicaid. Let's say if you already have Medicaid and you come in, we have to apply for a different, because there's in the Medicaid system, there's different Medicaid level or Medicaid type that you could apply for. So we're going to try to trigger the one that works with Medicare. So we would apply for that. And once you receive a letter, we send you to Social Security with that letter and let Social Security inform Social Security that you qualify for full Medicaid and you don't qualify for Medicare. Therefore, you come in to ask them to activate a Medicare number for you. And from there, once it's activated, we will send you back to Department of Children and Family to let them know you now have a Medicaid number. I'm sorry, a Medicare number, so they could activate one of the part of the Medicare for you. So basically, Medicare, Social Security will activate Part B, and then Department of Children and Family will activate Part A. Because technically, because you didn't work enough quarters, Medicaid is the one that's going to pay your Medicare premium for you.
Wow. And the premium for Part A is I think it's $550.
Don't ask me. I mostly know Part B premium.
Yeah, it's about $550. And the Part B for right now is 185. Nope,
185.
185.60. So you
Yes.
see, because I had an individual I did an application for, and they sent him the bill for the 3 months bill for the Part A and Part B. And when I saw it, I was shocked.
Yeah,
So
the Part A costs more.
yeah. So normally will you get both Part A and Part B at the same time, or
No,
one is gonna come, Part B is gonna come first?
Part B is going to come first.
Probably because Part B is the one less expensive. Um,
I guess so, because that's normally what Medicare, I'm sorry, Social Security activate first. Then the Part A, you send the letter to DCF to activate Part A.
305-945-1580. 305-945-1580. Listen, if you are if your parents may not be able to speak English or understand English, and you're listening to this show right now in English, this is the time for you to take that information and run with it. Contact me or contact Suze. Call me on 954-667-4885. 954-667-4885. You could reach Suzella on, I keep going from Suze and Suzella. I think
Seven
the
five four 236 4994. 754 236 4994.
again, it's 794-754-236-4994. 754-236-4994. That's the best number to reach Suze. I don't know if we could put that number on the screen. No, we can't? Okay. We're going to have Suze in the studio so she could enjoy all the perk that we have in studio. Normally, a process like that, how long does it take?
It could take approximately 3 to 6 months.
Okay. So
But
every single one of you that's listening right now, start acting on this right now. It's not we're not charging you for doing the application for you. It's not costing you anything. In fact, just think of the benefits that you're going to get from it, and your loved one, your parents, will be able to see a doctor without having paid the same benefits that someone with a Medicare and Medicaid are enjoying. That's the same benefit that, and with a Medicare Advantage plan. So those same benefits that they're enjoying, that's the same benefits that your loved one's going to be enjoying. And one of the things that I know, Suze, you may not be able to talk about this. Some of the plans right now, for the past few years, they've been giving what they call a meal card, and you're getting about $200 on a meal card in certain cases for some plan. So those are benefits that's out there that you should be aware of and take full advantage of them. And for more details, when you sit down with us, then we could go into details with you and help you get those benefits. One of the things is if God decided to bring me to heaven, I think this job will be the cause of it, because we are doing it to help you, and it's not costing you anything. So call me 954-667-4885, 954-667-4885, and you could reach Suze at 754
236 4994.
754-236-4994, 754-236-4994. So you could either reach me or you could reach Suze, and we'll help you, whether it's a low-income subsidy, whether it's filling out for Medicare, the application for Medicare, the application for retirement. I think, what else? There's so much that we get involved in. We help you with that, and it doesn't cost you anything. So call us now, 954-667-4885, 954-667-4885, and Susan's number for, again, 754 236
4994.
4994. By the end of this show, I remember this number by heart. It seems like you gave the number to the public. I don't have that number for some reason. I'm kidding. I do have the number. What other thing that can we talk about that we have not talked about?
I'm not sure.
Oh, okay.
Well, I wanted to also make it clear. There's low income subsidy versus Part B help, right?
What's
Those
the
are two
difference?
different programs. Okay, so the low income subsidy only applies for Part D prescription drug coverage plans,
Okay.
right? And you apply for that through Social Security, or any one of us could help you apply for it. Then Part B help is through what you call a Medicare Savings Program. So, low income subsidy is for Part D, and Part B is through the state of, Medicaid. You apply through DCF, which is the
Department of Children and
Department of
Family.
Children and Family,
Yeah,
correct.
that's a good
However,
point. Yes, go ahead.
once you apply, let's say if you apply for Medicaid, those who apply for Medicaid will automatically qualify for low income subsidy. They don't have to apply separately for low income subsidy. Some people don't qualify for Medicaid but still have low income subsidy. They have to apply.
So, how does that work? So you mean they don't qualify for because of the income?
Because of the income.
Okay,
Correct.
okay, I get it. Because what is the income limit for Medicaid?
Medicaid, if you single, 1700, 1737. If you married, couple is 2300.
So that those numbers went up in the past few years. Those numbers have gone up.
Yeah, it goes up a little bit every year. So for
Yeah,
2026, we don't know the numbers yet for 2026.
and when will we have an idea about the 2026 numbers? You know?
Probably in the next month or so.
Okay, okay. Tell me about what else we could talk about. Tell no, we won't ask you about that, but um, I think we touch on a lot of things in a short period of time, but let's well, we got to get everybody at the office, and so that one you talk about for you to review their benefits for 2026. There's a lot of change that's going to be making, and you sit down with them, review, and what are you looking for in terms of the benefits that they have now and what's coming into 2026? What will you be looking for in what they have and what they don't have?
It's really based on their needs. If year to year someone needs may be different. However, they're still in the same existing plan that they have, not knowing that there could be something else that's going to help them better for their current needs that they have now.
Okay.
So it's always good to compare. Some people medication changes, where they don't know that's their, it could be covered better from one plan to another. So it's always good to do a plan review. Even if your current plan that you have now, you want to keep it, there might be something within that same plan, another plan within that same plan that benefits you better. So that's why I tell everyone every year, even if you don't keep the same plan, it's always good to also do a review on it.
And earlier I mentioned how you methodically go over each medication that the patient is taking, and to make sure that that plan covers it. And what impact does that have? And do you anybody that's coming to see you, do you reassure them that they should bring all the medication that they taken, whether physically or on a list, for you to go through it?
That's recommended, yeah. So it's recommended that they do that because if you want to do a full review, you bring all that information along with your doctors and so forth, so you can have a full review on which plan is going to be best based on your needs for the following year.
305-945-1580. 305-945-1580. If you have a question for Suzella, right now is the time to call. The line is wide open for you. We are blessed to have to be in her present right now, because I've been trying very hard to get her on air. So now that you have her, take the opportunity to call. We have what, less than 20 minutes left for you to call, ask her a question, um, ask her if whether it's for yourself or for a loved one. Call right now, 305-945-1580, 305-945-1580. Don't forget, we're also live on Facebook and YouTube. In case you were not aware that everybody's looking at you right now, Suze, on Facebook and YouTube. So go on, subscribe. I had why are you doing that?
Well, you didn't tell me that. I would have been
uh,
more prepared.
well, you always prepared, so
Thank you.
I wouldn't worry about that. But yeah, go to WSRF 1580 AM, and on both on YouTube and Facebook. I help. There's a young lady that came in the office this morning, and she was told that I'm on air, and I make sure I grab the phone, um, put on WSRF 1580 AM live, and my picture came up, and I automatically subscribe for her. So I want every single one of you guys to do that. And if you appreciate the information that you're getting, that's the way to make sure that you make sure that the information it keeps coming every single week, whether you're at home or not. It will come straight to you, and um, so you could have that information. You know, I had an idea, and this suggestion is going to my friend in the back that's changing, and my friend up front here as well. That if we could put a button or something that says subscribe when we're on the air, even if you flash it, so we could remind people to subscribe. So I'll talk more to JS about that to see if it's feasible for us to do that. But call right now at 305-945-1580. Call 305-945-1580 and actually speak with Shiz. She's waiting for your questions. Now, let's talk about. Uh, you said the generic. There's not going to be any co-payment on generic as a whole.
No,
Or
I didn't.
some generic you may have a small copay.
Well, the level. I mean, the level of extra help the person qualified for, or is based on. Of course, there's different level. I believe there's about four different level of low income subsidy. So it depends on the level. So there's different copays based on the level.
Okay.
So if they have the Medicare Advantage, yeah, they most likely it's a different copay or no copay at all. But if it's just a prescription plan, there will be a copay.
All right. 305-945-1580. 305-945-1580. Why are we not getting any calls? 305-945-1580. Um, let's talk about what for Medicaid. What do you need to be eligible for Medicaid? That's a question for you.
For me,
Yes.
are you talking about someone who's on Medicare?
Yes. Someone who has Medicare and would like to apply for Medicaid. What information do you need from them?
Well, their income. Um, I first ask, what are you single, married, and what is your income per month? So because Medicaid is a state assistant, you get the help from the state. You have to have your income has to be a limit.
Okay.
So if your income, if someone come in front of me and wants to know if they qualify for Medicaid, I do a preliminary. I ask them a few questions just to see if they qualify, and I could tell them right away if they'll be eligible or not. So the first thing I ask, do you make more? Are you single? If you're single, do you make more than $1,700 a month? When I say $1,700, is total income, because some people get Social Security and they get pension, or those are combined income. So if your combined income as a single person is $1,700 a month, then yes, I'll proceed with the application. But if you inform me, actually, let me take that back. Remember, Medicare takes out 185. So your income has to equal, even what Medicare take out, it has to equal to 1,700. So if someone tell me they get a total of $1,700 a month, I have to add the 185, which is going to equal to 1,885. So you won't qualify. You have to make less than 17 to add the 185 to equal to 1,700.
Okay, that makes sense.
Right. So if you're a couple, the total income for both can be more than $2,300 a month. There's a little few change left, but 2,300, and I'm not sure what's the rest. But yeah, $2,300 a month combined. You cannot have more than that to
In terms
qualify.
in terms of money in the bank, what's the limit for you to be eligible for
For
Medicaid?
2025 limit for single, it cannot be more than 9,000. Couple 14,000.
So even for full Medicaid.
For full Medicaid, typically people will get full Medicaid, or like if your income is below thousand, like $800, like it. I can't determine full Medicaid. It's
Okay.
once the application goes to children and family,
Uh huh.
that's when they determine that. So I
Okay.
won't be able to determine if it's going to be full Medicaid or not.
Okay. Okay. That makes sense.
Yeah.
That makes sense. 305-945-1580. 305-945-1580. Give us a call right now with your question, and whether it's for a friend or a family member. Call us now, 305-945-1580. 305-945-1580. Um, next question for you. Besides, well, this if somebody has, you mentioned that the bank amount is $9,000, but sometimes some people come in front of you and they don't give you the full amount and they have 15,000. Okay.
Yeah.
If in a case like this, if they give you the true amount and they have somebody on their account with them, do Social Security take that into consideration?
Well, it's not Social Security,
I'm sorry, Medicaid.
Department of Children and
Yeah,
Family.
DCF. Yes, I should have known
Uh,
better. My bad.
yeah, most likely they will, because they're gonna, if the account is not, if the amount of money that they have in that account is not all theirs. Yeah, they would say whatever's theirs, and then they separate whatever on the application, on the Medicaid application. It does have a part where it says, is it a shared account, and what is the percentage amount that you have and that person have.
Yeah. 305-945-1580. 305-945-1580. That's something that that's usually. And I have some people that comes to the office, and I think I had somebody this morning that was there, and their the in the account that she has, the son was on the account with him. And another question about the um, and within that same context, they do have a part for a percentage for funeral expenses. So you could also claim funeral expenses as that part of that money. Let's say, for example, you do have 15,000. You could put 6,000 for funeral expense, and the 9,000 is no. I think they give you the maximum they give you for funeral expense is 1,500. But in the next Wednesday, Susan and I, we'll discuss it, and um, she's invited back next Wednesday so she could come out with more information. Hopefully, during this open enrollment, we should make it a regular appearance for you at least, so we could the information that we could discuss and on air that you'll be able to talk more about it. It's an open invitation. I think
Okay.
it's an open invitation. Yes, I think it will do the listeners a great service, and you could share your experience with them in terms of you've been in the business for quite some time, right?
That's
And so
correct.
you have a lot of information that you could share with them. All right. What's the last word you have for us?
Me?
Yes.
Um, just make sure you guys listen and do what needs to be done to get the help that you guys need. Because a lot of people don't know that they could get extra help out there. If you have any questions, feel free to ask me. Even if you don't call in to the station today, take my number down. Call me to ask questions. I'll be more than happy to assist you.
And your number again, 754.
236-4994.
So Susie's number is 754-236-4994. 754-236-4994. She'll be back next Wednesday, same
If
time.
God willing.
If God is willing, because what you doing the Lord's work right now. So,
Amen.
because in the Bible it says that my people are dying because of lack of knowledge. You bringing the knowledge to them. You're making me preach now. You bringing the knowledge to them, so that they don't die because of lack of knowledge. And the lack of knowledge come in different aspects. And this part is all joke aside, because the work that you're doing when you bring that information to them right now, I think is going to help a, 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 a large percent of the people that's listening to us right now. I was told that on an average we have about 54,000 people listen to this station. So, and I know that we got a great percentage of that listening to us, whether they're in their car right now or they're going to watch us on YouTube and Facebook. So we encourage you to call Suzella at 754-2.
364994.
Repeat it again. 754
754-236-4994.
754-236-4994. 754-236-4994. So you see, you got to come on more often so I could remember your phone number. So call Suze on 754-236-4994. And you guys could call her direct if you have any question regarding that for your mom, for your dad, for a cousin. And I think she might be even willing to set up an appointment to sit down with you, and if it's feasible. Okay? Suze,
Yes.
it was a pleasure having you on. I thank you
Thank you.
for taking the initiative to come on today.
Thank you. I appreciate talking to everyone today that are listening. And yeah, it was good.
Maybe one day we'll drag you down to the station and you could be live in studio.
Okay, one day.
All right, all right. Thank you. Now listen. Um, Other information that we want to discuss with you is that on the 17th, October 17th, that's when cost of living adjustment going to be official. How much it is, whether it's going to be 2.7 or 2.8. We don't know that yet, and we are hoping to have that information that day. Let me make a few announcements. What I would like to do is this whole month, I would like to dedicate every show this month to the following people. To all of you who have lost loved one in this ridiculous situation we have in Haiti. And I said ridiculous because all of us have lost loved ones, and some of us, our loved ones, and some people, they just they left Haiti and come back to the United States, and something that they had their hope and dream to live in Haiti. So we're going to dedicate that to all those people. And in particular, I would like to dedicate it to my father who left Haiti, Gene Franklin, who left Haiti, left his mansion, and now he's living in a condition that he never thought he would. And to my mom, Odette Franklin, that lost her life 3 years ago during Vagabond qui just came in and shoot inside their house. And all those who have lost loved ones who migrate back to the United States and lost their home. So we are thinking about you, and we want to let you know that, I was having a conversation with J.S. earlier, and we don't know what's to come, but what's the next step. But one thing we know that we got to keep hope alive. So let's say a prayer for Haiti this month, and hopefully, somewhere, somehow, God would finally say something about the condition that we have in Haiti, and so that condition could be changed. And for us, those of us who dream of going back home, that option will be on the table for us. Right now, there's no such options. And those that are there, basically, the conditions is getting worse and worse and worse. Now, my friends from Haiti that's listening, I hear you. And when you call, we understand your situation. Sometimes we're able to do something, sometimes we're not. But nevertheless, it's not that we didn't forget you. And in particular, I'd like to send a big shout out to Mami Modo. And please share this show with Dr. Frederic, who's been a great supporter of yours. And you guys keep sharing this show. Keep sharing the information. This is great information that you're getting on a weekly basis regarding Medicare, regarding Medicaid. We have the 3 to 4 hour slot where we talk about different health problems, how to resolve it. So go on WSRF 1580 AM on YouTube. Just subscribe it on YouTube so you could get it in your mailbox every single week. I make the sacrifice coming from Broward County down to Dade County just to make sure that you have that information, even though when I get here, I have to take a nap first before I get in the studio. So I'm making the sacrifice. You have to make the sacrifice and listen to the information that we provide to you. Not only listen to it, but share it. Okay? I want you guys to listen to it and share that information with a friend. Share it, continue to share it. And if you want to know what you could do for me, well, that's what you could do for me. By bringing that. If you want to know how you could pay me for bringing you that information, well, that's how you could do it. Share that information. I think it's Glenn Berry who said that when you put a seed in dirt, that seed will grow. But if you put it in cement, well, that seed will die. So we want to make sure that the seed that we're planting is on good ground, on solid ground. Again, my name is Gilbert Franklin. You could always reach me at 954-667-4885, 954-667-4885. This is the best number to reach me. Next Wednesday is a special day. Next Wednesday will be the 17th. That's when we'll have the number on the cost of living adjustment. For those of you who want to know how much your Social Security benefit is going to increase, Wednesday is the day for you to tune in. Make sure you're there. Make sure you subscribe. So start going, subscribe now so you could pass that information to a friend and a family member. Again, the number to reach me is 954-667-4885, 954-667-4885. This show is sponsored by Solis Health Plan. It's sponsored by Cladelia Management Services. It is sponsored by Alto Health. We love you. We see you soon. Bye-bye.